council meeting to order. Clerk, will you please call the roll?
Agent,
Here.
Clegg,
Here.
Halliburton,
Here.
Sanchez,
Here.
Thompson,
Here.
Woodings,
Here.
all present.
Thank you.
Madam Mayor, I have a motion
Sure, go ahead.
to defer, if I could. I moved to date 20 to a later date. Deferral is necessary because the contractor was unable to execute the agreement in time for tonight's meeting.
Second.
We have a motion and a second. Do we need a roll call for that?
I believe so.
Oh, no, Rob's saying no.
Oh,
All in favor?
Aye.
I can see everybody today. It's pretty cool. Opposed? All right, motion carries. And Council President, is that the only deferral you have?
That is, thank
Okay.
you.
Great, then we will move into item number 2, request for approval of the minutes of April 7th.
Madam Mayor, I move approval of the minutes of April 7th, the 5 o'clock executive session and the 6 o'clock meeting.
Although just to
Second.
be clear, there are no minutes from the
Right.
executive session, just the motion to go into executive session.
And come out.
Okay, good.
Right.
All right, we have a motion and second. Clerk, will you please call the roll?
Sanchez,
Yes.
Thompson,
Yes.
Woodings,
Yes.
Agent,
Yes.
Clegg. Clegg?
The council president looks frozen.
Yes, I'm still frozen. Now you're looking frozen.
Oh, but we can hear her. That's great.
Halliburton,
Yes.
all in favor, motion carries.
Thank you. Next up, under special business, first we have the reappointment of Tom Brown to the Electrical Code Board for a 4-year term ending April 2024.
Madam Mayor, I ask unanimous consent to reappoint Tom Brown to the Electrical Code Board for a 4-year term ending April 2024.
Without objection. And thank you, Mr. Brown, for your continued service. We appreciate it. All right, next up, we have the interim budget changes.
Thank you very much, Madam Mayor, members of the council. The interim budget changes were included in your packet. We had 4 requests and 1 informational item. I'd be happy to stand for any questions that the council might have.
And I see Mr. Burgos is here as well, in case there are questions. But if there are not, we can entertain a motion.
Madam Mayor, I move that we approve the interim budget changes as presented for the April 14th, 2020 agenda.
Second.
For motion and second, clerk, will you please call the roll?
Sanchez,
Yes.
Thompson,
Yes.
Woodings,
Yes.
Agent,
Yes.
Clegg,
Yes.
Halliburton,
Yes.
all in favor, motion carries.
Thank you. So next up, we have the weekly update on our emergency preparedness for COVID-19. And with us, I'm looking, it looks like that, I thought I saw Mallory. Yes, Mallory Wilson. Here, Ms. Wilson, and perhaps Romeo Gervais for part of this as well. I would, before we jump in and hear from our emergency team, I just want to make a couple comments. First off, this last week, we've had many conversations as with council leadership, between council leadership and myself and staff around the steps that we will likely be taking or we need to take tomorrow, and I'm optimistic. Looking forward to seeing the governor's decision in the morning on what will continue. And I believe it's important that after consultation with public health experts around this country and talking with council leadership and talking with the hospitals here, that we continue to do what's working after having asked our citizens for such sacrifice in the last 3 weeks. And I really appreciate the work of our city staff to, where they've repurposed their positions to meet current needs, where they've imagined what might be and developed plans to address those. And one thing that I want to flag today is that it was with great consternation that I learned in the media that there has been an outbreak at a long-term care facility in our city. After our record as a city of asking clearly and succinctly for data, for local public health expertise and support in making the decisions that we knew we needed to make based on information that we've had to learn and hear elsewhere. And that after all of that, we would not, as a city in whose jurisdiction a long-term care facility exists, be alerted by our public health district. So shortly before this meeting, there are others that should have been alerted that were not alerted either. Shortly before this meeting, I confirmed that the communication chains were not broken by city staff, and they were not broken by county emergency operations staff. That indeed the Central Health District sent a media release out with this information before contacting any elected officials or agency folks in our agency or other governments that would be overseeing this issue. This to me points to the very thing that we have been asking for continuously, which is open and clear conversation from the organizations that are supposed to be providing us with the information we need to make the right decisions for our community. And as I said to the governor last week, and I've said to others, in the absence of clear data, which we have been trying to establish so that we can project and make clear, decisive, and the right decisions for our community, in the absence of that, I'm going to continue to recommend that we fall on the side of health. And in this letter to the Central District Health Division, sharing my deep concerns, because we have an emergency management team that has put together clear protocols for what would happen in this very situation. We were not alerted and able to implement them. So I've asked them, in addition, for once again asking them for much of the information that we've documented that we would like to see from them. I've asked them for clarity on the dates that these tests were taken, the dates that the results were received, the steps that they took to ensure, the Central Health District took, because they did not alert us, to ensure that staff at the facility were protected, that those living in the facility were protected. I want to see the TRACE program that was developed by Central District Health to ensure that everyone that came into contact with these folks that unfortunately are ill have been contacted. Those that were exposed have been quarantined, and those that likely have COVID and have not been tested or tested positive have been isolated. And so by letter, just before this meeting, I asked for all of that information, including the information we've continued to ask to receive from the state as well as the Central Health District to be able to better meet the needs of the community. Our staff is doing everything they ought to be doing. We are asking the right questions, and all of us are going where we need to go to get information if we can't get it locally. But this points to the very issues that we've continued to raise, and that is that we need to continue to stay vigilant, to not take for granted a couple days of good results, and that we need clear chain of command and line of communication between the health district, if we are told as a city that that's where we ought to go, and the jurisdiction that sends public safety workers and frontline employees out into the field to keep the public safe, and ultimately is going to be held accountable for the decisions we make to prevent this from happening in the future, to prevent other outbreaks from happening if and when we go back to work, and to ensure that the infrastructure is in place to make that possible. And so with that, I hope to be able to come back to you with what I said to the health district is it's my sincere hope it was a mistake, and that from this, we'll finally get what we've been asking for. And in the meantime, we as a city need to know that the proper protocols were followed and that there's been follow-up to the nth degree to ensure that our residents are protected.
Madam Mayor,
Yeah.
thank you for letting us know the actions that you took. I also heard that report and was concerned because knew that I had not heard anything any other way. And I guess my question at this point, in addition to what you've done, is the emergency management team deploying the plan that we had for such a care facility? Are we now, or is Central District Health now the ones who would be in charge of such a plan?
I will say first that I've had no communication from Central District Health. I've asked them what they propose because they have not been able to answer in the past when it comes to chain of command. But perhaps Ms. Wilson or Mr. Riley, or even perhaps Acting Chief Gervais could walk through the steps, if we've taken any steps yet, and where our planning now, where and how it comes into play, given what we've now learned.
Thank you.
And so, Madam Mayor, council members, this is Mallory. You know, I mean, I also, of course, learned about it from Jade through the mayor. I hadn't even seen the news yet. And so I'm hoping that Chief Gervais can maybe provide a little insight, because I know that this was some of the planning that we had done on the fire and EMS side, you know, way back when, a month and a half ago. It feels like forever ago. So I am having to remember exactly what we had, what plans we had come up with for this specific scenario. I remember it being something that we were specifically wanting to address with the health district early on, to say, hey, given that this happens, what should we do? But I am unfortunately not clearly remembering exactly what we'd lined out for this specific situation. So Chief Gervais, do you have any other input on that?
You know, I don't exactly right now. I mean, obviously our first step is notifying our first responders of the situation to make sure to keep them safe. As you all said, I just found out about this, 15 minutes ago, half hour ago as well. So we're still in the initial throes of figuring out what exactly we need to do and to rely back onto those planning efforts that we had made previously. So more to come for sure.
Yeah, I would echo that. More to come. Gotta, make some of those connections with those responders, chat with the county and see what other measures they might have in place. I had chatted with Joe real quick before this to see if he had heard of anything, and he hadn't, aside from the news release either. So we will follow up on that and see what steps that we need to take. So then moving into the update for this week. Share my slides. Let's see. And I'm going to try to move through some of these initial kind of updates rather quickly, because we have some other kind of citywide hot topics in relation to this that I think we want to dedicate some more time to. But first, the current situation. These are the numbers I was able to pull off the site just recently. And I will say, as this continues to morph and grow, the way that data is being reported and displayed also continues to morph and change. And so the numbers that are here, I'm still trying to use those same consistent numbers from the state website, but even they are reporting numbers a little differently. Health districts are now also reporting presumptive cases in addition to confirmed cases. But I'm not exactly sure how and where those are differently captured between what the health district is reporting and what the state is reporting. And so these numbers, especially for the state and the county, I'm not sure that 9 deaths, I don't think that is including what was reported today from that care facility, because I believe we had 9 deaths yesterday as well. So I think there's a little bit of that lag that we're seeing in some of the data making its way to the system. But pulled down from this site today was right around 1,400 cases confirmed as of today. The other thing that I will mention in this is that these cases are numbers of when they are being reported. So it's not necessarily indicative of when the person was tested or when they first showed symptoms. So that's where some of this, data is good to look at trends, but it's not necessarily always great for that immediate snapshot in time, because it's when it's reported, not necessarily when the person was first got symptoms or when they first sought treatment or when they were tested. So
and these are data points that we've asked for, both the presumptive cases and whether or not trace programs have been developed. Since we're not testing, are they being treated as if they had it, which means tracing? and then also the dates of tests and when tests have occurred, so that we as decision makers and also frankly the public can understand the lag between when they were taken and the date that we're looking at today. Because again, as we think about the virus is 2+ weeks ahead of us, and as we think about those policy decisions we need to make, having that clear and transparent becomes even more important for the public to understand the decision, the points and the decision and the data that we're looking at.
Yep, exactly. And as, so I'll kind of move to some of the graphics that are a little easier to look at. And I think that kind of speaks to the point of that as we're looking at making further policy decisions, that at least 2 weeks of continued reporting of decrease in cases is going to be really significant, because there is this lag based on when people were symptomatic and when they got tested and all this stuff. So we can see though that there is a little bit of good news currently in that it still looks like our curve is flattening a bit. You can see the change from last week to this week and how that looks. And then the new case trends. So this is, again, the orange is the state new cases and the gray is the county's new cases that have been reported. So Thursday was a big spike. All the higher spikes seem to have been on Thursday. So I'm not sure if that's just, again, some weird lag in the reporting or in the way that the data is coming in. But Thursdays have seemed to have always been a bit of a big day as far as cases coming through. And we saw that this last Thursday as well. Looking towards kind of comparing the rate between the county and the state, we're coming a lot closer in alignment. Earlier on, back near the end of March and beginning of April, the state as a whole was increasing a lot more steeply than we were in the county. But I think maybe because of the governor's stay-at-home order, or just everyone doing a better job of practicing social distancing around the state, the case numbers are kind of increasing at a similar rate now. So we'll keep pulling this down from the state website every day to kind of keep an eye on things. And then I know that Kyle is also working with the data team from U of I that's getting the data from the state, and with folks at the county, as well as some of our university partners, to try to get that data and get some modeling based on that data, so that we have some better stuff to work off of than my simple graphs here. And then a quick, again, the resource center is still up and functioning. And as we are seeing a pretty significant decrease still in the number of calls and emails, and especially as they are related to COVID, it seems like most of the calls these days are largely just general city operations related, not necessarily COVID, but that resource is still there to field those calls and those emails from the public. So a quick update across the departments. Just wanted to give you guys a quick brief on all the different departments and what's going on. Generally, city operations are functioning as normal as they are for our current situation, maintaining those essential services. So I'm not going to read through all of these, but I will leave each slide up so you guys can get a view of it. And if you have any questions on any specific ones, we can try to answer that. Some of the highlights is, I think, airport renegotiate some of their fees with tenants and airlines, given the decrease in traffic there. The Be Well Boise campaign, community engagement, is focusing on getting that rolled out and implemented. Finance administration continues to work with parks and doing the social distancing ambassadors, increasing education and communications.
Madam Mayor, Mallory, 2 questions real quick. On the airport, what are we doing to educate the public as they arrive at the airport, what the new social distancing standards are?
Jay, do you have any insight into that? That one actually was a new one for me. I hadn't seen that one before.
Yeah, I can get some greater details, Mayor, Council, President Clegg. I don't have the specifics, but I know that community engagement and Sean Briggs out at the airport were working on kind of a multifaceted, both the web and some in-person education. So I can get that information as a follow-up item, but I saw email traffic that they were working on both the web piece and in person.
Yeah, I just wondered if, someone hadn't heard and they arrived to pick someone up, and just how
Yep.
we were informing them. Okay.
Yep.
And then, continue to hear questions around the enforcement in Parks and Rec, and that the social distancing ambassadors are only working when they're around and not, as soon as they leave. At least some people continue to not follow the social distancing guidelines. Wondered if we are thinking about actually fencing off some of the playgrounds, or if we've made any decisions about that yet.
Madam Mayor, Council President Clegg, we on the playgrounds, what we've decided is the next couple of days we would monitor, and those that were kind of our highest repeat offender park playground areas that we would consider fencing. The idea of kind of a full fencing of all of our playgrounds was pretty significant, kind of a labor effort. And so we just thought we would kind of monitor that from a data perspective. And if we had some that we just, for the next several days, people were just not being good citizens, then we would move to construction style, fencing like we have at the skate park.
Thank you.
So moving on, so a couple highlights here is fire department looking to bring the Recruit Academy back to an in-person for the remainder of it. They've been doing a lot remotely as much as they can, but they've kind of reached the point where it needs to be able to do some hands-on training, but making sure that all the appropriate safety measures are going to be in place to complete that. In order to make sure that that graduation date is achieved, to be able to get those firefighters out on the line and fill some of those gaps in staffing.
Madam Mayor?
Yes, go ahead.
Thank you, Mallory. So in regards to the recruits coming back for training, are they going to be tested to make sure that they don't have COVID-19?
Chief Gervais?
That's currently not part of our protocol. I mean, in the sense that we don't randomly test people. So if I can understand the question correctly, basically they will be coming back and limited to that. They're not going out on the line right now. So they would be coming back into Recruit Academy. We would be predominantly using them in exterior, outside, hands-on kind of manipulative skills in smaller groups to practice that social distancing component. But if they're not showing signs and symptoms of the illness, we would not be testing them.
So just to clarify, coming back on site to do training, they're going to be doing it with the 6-foot social distancing in place?
Yeah, as much as humanly practical. I mean, like I say, they're going to be throwing ladders and doing different things along those lines, the skill sets that they need to be able to operate. But we'll break them down into smaller groups, and then that pool will be isolated. So we're not bringing in outside adjunct instructors and things like that from the rest of our firefighters. It's only going to be the training officers and the training cadre. So it'll be limited to 15 or 20 people or so. And then we'll take those groups and break them down into smaller pools of groups, if you will, to be able to do that. So yes, as much as practical, I probably can't say that at every moment of the day that if they're throwing a ladder or climbing a ladder, that they'll always be 6 feet apart. But yes, we will try to do that as much as practical.
Thank you.
So everyone else is kind of rolling around. I will say IT has been a great hero of this effort as far as city operations go. They really have enabled all city staff to continue to work practically seamlessly. We're able to do this meeting via this platform tonight. So shout out to IT for their continued support and work to support the rest of the city being able to continue to function through this. Parks, already talked about parks a little bit, but all the kind of courts were closed last week to ensure that social distancing compliance. I'm gonna, move my screen around. And then again, working on that education component in parks and trails. Same with police. And then some of that alternate service delivery as we get to warmer weather. The big highlight from Public Works, and I know Steve's on it if he wants to expand upon this or any questions about this. The big thing they're working on has been their contingency planning for the water renewal facilities, and securing those travel trailers, given that they need to shelter those workers in place at the facility, to both keep them safe and ensure that we can continue to run those facilities as critical infrastructure for the city.
Madam Mayor.
Go ahead.
Mallory, how is the ambassador program working in terms of getting folks to comply with the social distancing orders on the parks and trails in Greenbelt?
How's it going, or and Jade might be able to fill in a little bit on this as well, but I know they're out there talking to a lot of people, but I think, as you mentioned, I've seen reports that a lot of times as soon as they leave, folks are not complying. So I think they're doing their best effort to do that education first effort, and then see what else it can do. Jade, any additions?
No, Madam Mayor, Councilmember Sanchez, that is correct. We're just trying our best, and obviously things increase when the weather gets nice. And so we've increased plans between Craig Croner's group, who's the first line of defense, and then police is the second line of defense, just anticipating weather getting better. And so how do we kind of increase use of force? And at the end of the day, we keep reinforcing that if people can't be good actors, that in some instances we'll ask the mayor to do more aggressive closures if they can't police themselves. So we've just tried to lead with just good role modeling and code enforcement out there. But it might come to certain specific spots having to have partial or full closures if people can't abide by that.
Madam Mayor, just a quick follow-up on that. So Jade, with the playgrounds where people are not respecting the yellow tape, are we going to base whether or not we take more aggressive action to close those off based on complaints that we get from the public?
Madam Mayor, Councilmember Sanchez, we were doing it more based on data as provided by the field officers. So they are geocoding and logging each of their kind of observation issues. And it's not to disrespect the complaints from the citizens, but it was just more based on kind of empirical evidence on the ground, and which parks are we just consistently seeing people not willing to comply.
Thank you, Jade.
Madam Mayor,
Go ahead.
if I could ask a question of Steve. Steve, this is, I think, as much for the public as anything else, but just walk us through the travel trailers. They'll be secured. They won't be deployed unless needed. So essentially, we're reserving them, as I understand it, and then if we need them, we'll actually deploy them. Could you walk us through that a bit?
Sure, Madam Mayor, Council President. So our plan is to basically have an option to purchase. And so we've contracted with 3 RV dealerships with an option to purchase. I think it's up to 23 trailers. And in the interim, that option to purchase, I think, is about $11,625, I think. If we end up not having to shelter in place on site at the facilities, we'll only be out the $11,625. If we do end up moving forward with the purchase, the contract we negotiated will have travel trailers out on site within 48 hours. And that option to purchase lasts for 60 days. And so even if we were to purchase the trailers, having talked with the dealerships, they feel like we could probably get a 50% sale back if we were to purchase the trailers. But at this point, it's only an option to purchase. We haven't purchased the trailers yet. They're not on site. We just want to have that as a contingency. We have very specific trigger points in our contingency plans. When X happens, then we'll pivot to this. We haven't triggered that yet, but we want to be able to pivot quickly if we have to.
And Madam Mayor, Council President Clegg, the other piece is we are pretty, very confident that this would be a FEMA reimbursed expense as well, as should we have to go the full distance.
Yeah, thank you. That was going to be my second question. Thank you.
Madam Mayor,
Go ahead.
I noticed that Cody's on the line. Hey, Cody. And there's a note here in PDS, and there was a note in the legal section about opening up some things starting in April. And I'm wondering if Cody can just give us a quick little blurb about what that might look like for applications in PDS.
He is next. He's later in the queue. We have him
I'm sorry.
No, it's okay. He's a presenter for tonight. Thank you.
I should have had a list of items we're going to cover tonight, as it is a little broader than normal, but yeah, we will get to that.
Yeah, we have quite a few hot topics. We have Cody, we have Linda and Eric on where we sit on budget, and we have Kyle on kind of best practices for how we kind of approach reopening certain pieces.
Great. Thank you for that roadmap. That helps me a ton. I won't ask questions out of turn then.
No, my apologies. I should have added that at the beginning.
Madam Mayor.
Go ahead, Councilman Halliburton.
Yep. So I guess I had a question, maybe just a follow up with Steve in Public Works. I think that you could see how the City Council was quick to approve those needs for the water treatment centers in the Public Works Department, and it does seem like it's a pretty big and like significant ask, if those things need to be deployed. I just want to make sure that we're doing everything that we can to support the folks down there. And I don't know if there's other needs or things that we think that we may have to address beyond the trailers going forward to make sure that group of folks are able to continue their work down there.
Steve, do you want to speak just real quick to the appreciation pay?
Yeah, I was going to bring that up. So, Madam Mayor, Councilmember Halliburton, one of the things that we're working on, and I think we're going to roll out tomorrow, is what we're terming appreciation pay. And so, for those folks that are providing essential services to the city, and frankly, potentially exposing themselves during work hours, we're going to have an appreciation pay. It's a 15% bump per hour worked on the front lines. And so I think that's going to help acknowledge a lot of the work that's happening at the facilities. So that's happening as of tomorrow. We'll be rolling that out. Other than that, I think we're in good shape. Morale is good. Certainly the mayor, I really appreciate your shout out on the Facebook Live event. I reposted that back to the group. Those things are really helpful. Things are going well. I appreciate a lot of folks are asking, hey, is there anything you need? I really appreciate that. I think we're doing well right now.
Okay. Thank you, Steve. And then I guess just one other follow-up question. As far as with our ambassadors that are at the parks and the work they're doing, I know that we don't want to ticket people, and we've been avoiding that. Is it a ticketable offense when people are taking down tape or removing tape from the parks? Like, is that to the point where it actually is a misdemeanor, or are we not at that level?
Madam Mayor, Councilmember Halliburton, it is, and we continue to kind of monitor, between the education and the enforcement piece. I do think at some point in certain parks, we're going to have to start ticketing people. Tomorrow, we're increasing our focus on animal dogs off leash and that type of piece, because people are getting pretty flagrant of just not wanting to follow the rules on that. But I do think the playgrounds and the social distancing is going to come into play, that we're going to have to probably start issuing at least formal warnings and then eventually tickets, just to show that we're serious about that.
Thank you. I appreciate that clarification.
Madam Mayor. And then Councilmember Halliburton, I will add on to that, in addition to Steve's comments, that I know that the folks on the incident management team are working with Doug and the facilities folks and some of the other staff at Public Works to make sure there's plans in place to support some of the additional needs that might come up with having those travel trailers. So if we're looking at feeding and some of the other logistical stuff that might come along with that, with having those folks shelter in place. So some of those contingency plans are being worked on, I know, as well, to support that effort. So with that, a quick update on some of the other efforts going on. That community partnerships effort continues to move along. They were able to kind of finalize that community isolation bed plan that was briefed out last week. And I think there's some MOUs in the business and the agenda that speak to that. And then kind of looking a little broader at the city response plan for the future. It's going to be expanding a little bit, I think, as we see each week with these briefings and the questions that come up and all the various folks that are going to be on briefing later and that are answering questions, that this response is broader than just an emergency management response. It's not just, you know, a flood that's affecting the river and affecting certain aspects. It's affecting every aspect of our organization. It's affecting pretty much every aspect of our community. And so it really is going to take, and is taking, a much broader city response than just say what's housed in emergency management. And so with that, and I think you guys council received a document on this earlier today, I believe. A couple of additional work streams that we're going to be addressing to kind of address that larger city effort that needs to happen, to include some of the emergency management stuff that we've been doing, but, you know, looking a little broader again to our organizational wellness, making sure we're approaching the community wellness, the financial aspect that Linda's going to talk about in a little bit. So more to come on that. We're continuing to build that structure and how that's going to be kind of reported, but just wanted to give you guys a heads up that we are taking that broader look across all aspects of this incident and the city as we move forward. And then
Mallory, to, you know, Madam Mayor, councilors, to that point, we are, if there's certainly any questions on kind of those what we're calling work streams and the lead staffers, you know, let us know. We'll pick those up at future briefings. We will give you a more holistic update on Fridays from each of what we're calling those work stream leaders in each of those function areas. You know, that's just kind of an updated piece that we'll give you on Fridays of just kind of what's been accomplished from the week, you know, behind, what do we hope to do the following or the upcoming week, and where do we see challenges on the horizon. So just trying to posture some of this work for kind of mid and long term.
Yep, exactly. And then with that as well, Kyle will speak a little bit later on some of our, you know, other best practices we've been seeing and that planning effort. But he is now tied in with the folks at U of I that are getting the data from state health and welfare and coordinating with our county and some other university partners on some of these data requests that we have been asking to see how to best ask for that data, to use that data. And so a little more to come on that, but we were able to get plugged into that effort this week. And so with that, I will toss it to Kyle to talk. I will advance the slides for him. So Kyle, let me know when you want me to go on, but we'll toss it to Kyle for, again, that adaptive response.
Thanks, Mallory. Madam Mayor and council members, good evening. As I did last week, I'll start my presentation with a disclaimer that I'm not an infectious disease expert, but I have been tracking guidance from experts across the country about how local governments might approach recovery efforts. So last week I shared some slides with you about when and how experts recommend that we lift healthy distancing restrictions. And then tonight I wanted to provide a quick update. Again, my slides mostly come from a recent Harvard webinar on local response best practices. So this first slide that you can see is very similar to one I showed last week. At the top, you can see an illustration of how cases over time might look for places like Italy and New York City. There's an initial large spike in cases followed by some subsequent outbreaks. And of course, we haven't actually seen those outbreaks yet. This is just an illustration. On the bottom, there's an illustration for how cases might look like over time for a place like Singapore. And for me, there are three main takeaways from this slide. First, putting strong restrictions in place early likely does flatten the curve and result in fewer deaths over the long term. And you can see that in the difference between the curves for Italy and New York City on the top and Singapore on the bottom. Second, we should be prepared for subsequent waves of outbreaks once we lift restrictions. I've been in contact, as Mallory mentioned, with academics at the University of Idaho who are doing some modeling in this area. Their work suggests that if we were to lift all social distancing restrictions now, we'd likely see a big spike in cases within a month. So we should definitely be prepared for future outbreaks. And finally, we should respond slowly and thoughtfully. So as new cases wane, we can slowly open the faucet, we can lift some restrictions and see what happens. But if we do begin to see another outbreak, we might need to put restrictions back in place. Next slide, please. And here's another slide you might remember from last week. It shows the 3 criteria we should consider before lifting social distancing restrictions. The first is that cases are no longer spreading widely. So, if we're seeing many consecutive days or even weeks in which there are no new cases. The next 2 criteria are really about capacity. So do we have the healthcare and hospital capacity to respond to another outbreak if it occurs? Do we have enough ICU beds, ventilators, et cetera? But also, do we have enough personal protective equipment to protect healthcare workers and make sure they're safe? And then finally, do we have enough public health capacity to respond to another outbreak as well? Can we test a lot of folks and get results very quickly? Can we trace contacts immediately? And I should mention that right before this meeting, Mallory alerted me that the federal government, so CDC and FEMA, came out with some guidelines that they call a framework for reopening America. And in the 90 seconds I had to take a look at it before this meeting, it looks like the thresholds that they offer are very similar. So very similar to these 3 criteria we're talking about tonight. So that last piece around contact tracing is one I want to talk a little bit more about tonight. Next slide, please, Mallory. So, the shortage of tests nationally has been widely reported in the news, but not so much the shortage of capacity for contact tracing. And you can see a quote here from a recent Johns Hopkins report on this front. So what it says is, in order to trace all contacts, safely isolate the sick, and quarantine those exposed, we estimate that our public health workforce needs to add approximately 100,000 paid or volunteer contact tracers to assist with this large-scale effort.
So that's nationally, Kyle, that's nationally.
Yes, that is, thank you, Mayor. That is nationally. So obviously there's a significant need nationally. Next slide, please. So what is contact tracing? It's really about identifying and isolating folks who have been exposed so they don't spread the infection to others. More specifically, there are at least 4 key steps to contact tracing. And this is work being done right now by Central District Health. So step 1 is once there's a positive test, folks doing that contact tracing would be notified of the positive test. They then interview the patient to identify all the people that patient had come in contact with. The person doing the tracing would then reach out to folks who have been exposed and then monitor them daily for symptoms for a couple of weeks. Next slide, please. And this slide shows a visualization from some really great recent reporting from Reuters on the early spread of COVID in South Korea. So the figures on the screen, the little people, represent the first 12 COVID cases in South Korea. Red figures are folks who were infected outside of Korea, I think almost entirely in Wuhan in China, and then brought back that illness to South Korea. And the blue figures are folks who caught the virus locally, so not from traveling abroad. Next slide. Now we add in the number of folks each patient exposed before realizing they had coronavirus. And you can see it's a lot, right? You can see even the patient at the bottom, patient number 12, had contact with 422 people. And this is only people the patients had direct contact with, right? So if it excludes everybody on the bus they rode home with every day after work. And for me, there's a few takeaways from this slide. First, it's that social distancing is really about ensuring that patients expose 0 people or only a few people and not dozens of people. Second, it shows how crucial contact tracing is. If we can track down those contacts quickly and quarantine them and isolate them, we can stem the spread of the virus. And then finally, it really highlights that contact tracing is a lot of work. This is just 12 patients, and they had hundreds of contacts, all who need to be interviewed and monitored. Next slide.
Madam Mayor. Madam Mayor.
Sorry, I was muted. Go ahead, Councilmember Sanchez.
Thank you, Kyle. So a question regarding that last person in the previous slide. So just to make sure I understand this correctly, that individual had contact themselves with 422 people? direct contact?
Madam Mayor, Council Member, that's a great question. Yeah, and I can send out the link to this article, but what it really highlights is the impact of kind of clusters of contacts. So folks who were at a number of large group gatherings and the impact that had. The person number 12 was all the contacts happened at a very large church. But we see similar things in, like, you know, if you would visit a concert or you were in the hospital, say, you might have direct contact with a lot of folks over the course of several days before you realize you're infected.
Thank you for clarifying.
And finally, experts say it's a best practice to provide resources to those who have to isolate so that they can stay home. You know, if you're somebody living paycheck to paycheck and without access to paid sick leave, a couple weeks of isolation could be really burdensome. So support could include everything from care packages to access to telemedicine, to grocery and prescription delivery, to financial support. So that completes my presentation, but I'd be happy to answer any questions you have.
Madam Mayor. Yes, thank you. I have two. First, on these care packages, who would be providing those? Is that from the government? Is that from food pantries? And then also, the number one concern I'm getting is the lifting of the social distancing. Now, there's, you know, we'll hear from the governor tomorrow as far as the statewide, and it sounds plausible that he's going to extend that. That sounds where it's going, and we hope. But if either way, Boise's went in place, as I recall, March 24th. So that gives us till April 24th, I think, somewhere around that date. Is that correct? And then we could continue to extend, the mayor could continue to extend, correct? Those are my two questions.
I can jump in at those. The slides that we asked Kyle to show are to demonstrate the infrastructure that needs to be in place to be sure that we are ready to reopen things, you know, when the time comes. If we really want to reopen and have everybody back, we've got to have like infrastructure in place to test, to trace, and then to support those who need to isolate or quarantine. Right now, we are not proposing that really this is why state and federal plans and support around these programs are so important, because of the scale that it needs to be at to be done well. And then your second question with regard to the orders, yes, it's my hope that tomorrow we will, it will be, because we know that doing it just as one city isn't nearly as effective as taking the steps regionally or statewide. And so we'll look to see what the governor has decided to do. And then we will, as a city, if necessary, provide orders that continue, you know, the social distancing, stay home, stay healthy orders that exist right now. And our orders, when the governor made his, we rescinded our other orders just for legal reasons to clean everything up. So there's no restaurant closure order in effect right now. It's the governor's order. There's no order related to events. It's the governor's order. And so if anything's pulled back that we deem not in the best long-term interest of our health or economy here in the city, then we'll add those things back in.
Thank you.
And Madam Mayor, Council Member, if I may, one point that's kind of germane to this conversation is, from my very quick read of the CDC and FEMA guidelines that they just published, they recommend that there's no reopening that happens until May 1st at the very earliest. And so that's a federal guidance at this point.
Thank you.
Madam Mayor.
Go ahead, Council President.
Thank you. Kyle, or whoever may or may not have an answer to this, do we know the capacity needed for contact tracing in Idaho? Of course, it will, I'm sure, be somewhat dependent on how many cases we end up with if we have a second spike and those kinds of things. But question being are there plans in place for us as a city to augment that if necessary, or is Central District Health making plans to do that? I'm assuming that's probably part of your ask in your letter.
Council President, it is part of the ask in my letter. And other leaders in the county and the Treasure Valley, I should say, actually, have been discussing more and asking more questions about what infrastructure exists, what plans have been made, where is the county health, the Central District Health or Southwest District Health, because we're looking at the region on this, and where is the state on this?
And Madam Mayor, Council President, if I may, the one rule of thumb I've seen from experts on this is that we should be prepared for something like one contact tracing person for every 1,000 people in the population. So for Boise specifically, that'd be something like 230 people. So quite a lot of folks.
Oh, yeah, it is. Okay, thank you. That's helpful.
And Madam Mayor and Council President, I can reference the latest situation report from Central District Health that I believe I get forwarded to you guys when it comes out weekly, that they are currently with their contact tracing focusing on high priority groups. So healthcare workers, I think some like long-term care facilities. They had a couple of groups pulled out, but it's in their situation report that they are only focusing on those high priority groups at the moment based on their capacity.
Madam Mayor,
Yes, Council President Bergeron.
to follow on to the information that Mallory just shared, Mallory, are they working to increase their capacity there, or have they offered any indication of that so far?
I know that, it's like it says they have expanded their epidemiology capacity for this. I'm not sure specifically where that's coming into play. I know the health districts do use generally, speaking generally, not specific to this, but use a network of volunteers to the Medical Reserve Corps. And so I'm not sure what their specific plans are in relation to how they're doing this, but it is expanded per what they've said.
Madam Mayor, Councilor, one thing I would mention, and I had to step off for a second, so maybe someone already mentioned this, but last week we had Mallory make an offer to Central District Health of, we are happy to repurpose any city employees and resources to work as tracers on that front. So we have made a good faith effort that we could repurpose significant amount of city employees should they want those resources.
Well, and Jay, I'll actually clarify that I reached out to Kelsey in HR and then Jamie in legal to see what it would look like from the city as far as our ability to do that prior to reaching out to the health district. So I actually haven't quite reached out to the health district yet based on some concerns that both HR and legal had. But if we would like to, we can further pursue those and then pursue it with the health district if that's something we'd like to pursue, excuse me. And Mayor, I know, like you said, that there is a larger effort was brought up in that regard, kind of valley-wide, but if that's something I'd like to see, I can pursue that again with HR and legal to see what it would look like for us to be able to do that from a city perspective.
Yes, I would like us to determine what that would look like and whether it's possible. Talk with other leaders across the valley about their interest in doing the same.
Madam Mayor?
Yeah.
Go ahead, Council Member Sanchez.
Thank you. Mallory, there was an article that came out in the Statesman by Nicole Foy that pointed out that the state is not tracking the race and ethnicity of folks who are diagnosed with COVID-19. I don't know what the communications are going to be like from here on out with Central District Health, but if there's any way also, Madam Mayor, if we could convey the importance of that, the significance of tracking that information, and if they are not going to track that, is there a way that we can make sure that we are tracking that information?
We'll add it to the list of data requests.
Thank you.
Great, go ahead.
Yep, sorry, I thought I had something else to add to that tracing conversation, but it seems to have left me, so I guess we'll see if it comes back. So moving on to financial impacts. So Eric, I'll let you take over talking.
Thank you very much, Mallory. Appreciate it. So I'm going to be focusing for the purpose of this conversation on fiscal year 2020 budgetary impacts associated with this event. I will be returning to present to the council next week and the week after around some of the discussions we're having around fiscal year 2021. We're still very much kind of working through what we think the revenue impacts and such are. So in terms of fiscal year 2020, this slide demonstrates, kind of the magnitude of the revenue reductions that we are looking at. And before I go through any of them, I'd just like to preface by saying all of these are, estimates at this point in time, and they're going to be determined really by the duration of this event and, on the, I guess, how much this permeates into the community. This is pretty new, and we're certainly giving it our best shot to come up with our best revenue estimates we can. We also know that each revenue category behaves differently, and so we're trying to account for that. And then the other thing we're trying to account for is we did have some strong performance early in this fiscal year. The first 6 months of largely the first 6 months of the year, we were doing quite well. So you might be surprised to see development fees or liquor tax not included on this list. And the reason being is that we were doing quite well earlier in the year. We might finish within budget within those categories. So as you look at sales tax, we're anticipating, about $3.2 million being shy of our revenue this year. When we look at property tax is a relatively stable category. However, what we are allowing for here is some level of delinquencies. When we do have a delinquent property tax, essentially a lien is placed on that house, and we would eventually get the receive those property tax collections. However, we might not receive it within this fiscal year. Obviously, parking is an issue with so many people abiding by the rules and social distancing and staying home. We've seen a precipitous drop in our parking revenue. And really the largest one is our parks and recreation. To the degree that, we are not able to offer a lot of our recreation programming, or we have our certain facilities such as the zoo or Idaho Ice World or even our golf courses closed, we're not able to receive any or collect any revenue associated with those facilities. And in that last category, other, that's kind of a catch-all. An example of what would be included in there would be traffic citations, right? So as so many people are staying home from work and staying home from school, there's been a pretty steep drop in the number of traffic citations that our police department has been issuing. In terms of the parks and recreation, one thing that this does not account for, and I'll dwell on this a little bit more on the following slide, is to the degree that we don't offer all of our services that we normally would, or have all of our facilities open, there will be some level of expenditure savings. Whether it be, supplies and materials, or temporary staffing that we might not bring on board in the absence of having these particular facilities open. And we're very much working on coming up with an estimate in terms of how much we might have from an expenditure standpoint. Next slide, please, Melanie.
Madam Mayor, could I ask a quick question on that, Eric?
Sure.
Councilman Thompson.
Thanks. Just expand, Eric, a little on the sales tax. Help me understand why there would be a shortfall. What's causing that? I don't know exactly. Thanks.
Madam Mayor, Councilmember Thompson, thanks for the question. We've built in a reduction in sales tax. If you think about, for instance, restaurants and bars being closed, people, not necessarily going out and partaking in different activities and events, and also to the extent that people are seeing financial hardships with their employment situation. we're essentially building in a reduction in sales tax attributed to those types of factors.
Makes sense. Thanks.
Madam Mayor,
Go ahead, Council
Eric.
President.
Eric, little follow-up on the sales tax. With the revenue sharing formula change this year, which I think takes effect July 1st, do these numbers include what we anticipate we'll lose from that as well?
Thank you very much. Yes, we have tried to account for that because there is a bleed over, or, a difference in our fiscal year versus the state's fiscal year. And next week when we go through our revenue estimates, we'll touch back on that point as well, because we're going to be constrained by our revenue loss this year into next year as a result of that formula change.
Thank you.
In terms of expenditure implications, what we've tried to capture on this slide are expenses above and beyond the department's ability to support costs. So what you won't see on this slide would be staff time. Staff time is already budgeted within each department. You're not going to see backfill costs and overtime. But what you will see are things that, again, departments might not necessarily have the ability to absorb, or are large costs that were not planned. The largest being expenses in support of our vulnerable community members. That would include, sheltering costs, various hotel services we have available, other services such as the continuation of service at Corpus Christi Day Shelter. Within our Housing and Community Development Division, we have forgiven rents in the months of April and May, and the general fund will essentially make the housing funds whole for that. So that's what we've tried to capture within that $2 million line. The technology, obviously there's expenses associated with, folks working from home, licensing and equipment and such. Cleaning and personal protective equipment. An example of that would be our police force and making sure that our patrol vehicles are cleaned between each use. We've talked a little bit about the shelter for critical staff, and we also talked a little bit about appreciation pay. Now, some of these expenses we might not see continue for the duration of this event, such as the shelter for critical staff or the technology. Other expenses, such as shelter for our vulnerable community members or cleaning and personal protective equipment, would likely continue for as long as this event continues. Next slide, please. In terms of how we intend to deal with this issue, we are very much hoping that we can preserve as much of our capital fund balance and our cash flow reserve as possible. So as such, we are thinking about offsetting these revenue losses and expenditure increases through contingency accounts that we have in place in this particular year. An example of that would be our operating contingency, as well as vacancy savings and M&O savings. I talked a little bit about, within our Parks and Recreation Department, to the degree we don't have all of the services offered, we are likely to have some degree of offsetting expenditures. We're very much, trying to maximize savings across the organization. We've had discussions with our executive management team about, deferring and reducing any non-essential expenditures to essentially allow more and more of those financial impacts to be absorbed. And we are, working very diligently and trying to determine our projected expenditure savings. And as this event continues, we can bring updates before the City Council in terms of how we are in terms of the balancing. I'd be happy to stand for any questions in terms of fiscal year 2020 financial impacts.
Madam Mayor,
Go ahead.
I just want to commend Eric and everybody for being so judicious with our funds during this time. I know that we do have a significant capital fund balance, and I think it would be really easy to just fall back on that. But I think that this shows a lot of stewardship over the resources that we have. And I really appreciate it. So thank everyone who's been keeping track of all the pennies and making sure that we're using our resources as wisely as possible.
Thank you.
All right, pending any other further questions, we will move on to Linda with a overview of some of the federal funding opportunities.
Great, thanks, Mallory. Madam Mayor, members of council, I'd like to start by just giving you a general overview of the COVID-19 federal funding situation. Then I'll go into some sources of funding that have been made available, and we'll dive a little bit deeper into a source of funding that's made available to the state and potentially local governments. So there's been 3 phases of legislation that have been passed so far by Congress when it comes to this event, totaling about $2.1 trillion. The first phase, about $6.5 billion, was focused on supplemental funding for the CDC and public health agencies for operational readiness. The next phase was $3.5 billion, which was focused on protecting workers with paid leave and expanded FMLA rules. And the last, most robust and comprehensive package was the Coronavirus Aid, Relief, and Economic Security Act, or CARES, for $2.1 trillion. There is another 4th phase of funding currently being negotiated in Congress, which may include another $250 billion for the Paycheck Protection Program for small businesses, and potentially $250 billion for local governments to cover revenue losses. The city has established a funding working group. The working group includes representatives from the mayor's office, legal, finance, internal audit, as well as the state and federal lobbyists who are providing us with up-to-date information on funding sources and eligibility as it evolves. The working group will develop and coordinate strategy around applying for the federal and state reimbursement opportunities. Another aim of the working group is to ensure that we have robust monitoring processes in place related to the funding and the spend of those funds. The city's strategy will be to pursue as much funding as possible to cover all anticipated unbudgeted COVID-19 related expenses and revenue losses if possible. Next slide, please.
Should be up.
Okay, just a little bit of delay on my side. So sources, like I mentioned, the most robust comprehensive source of federal funding that's been provided, especially for local governments, is coming from the CARES Act. There's been several different sources identified under CARES that the city or our community partners may be eligible for. There's federal funds that have been made available for law enforcement, firefighters, emergency management, emergency food and shelter, social services, housing, community development, airports, and transit agencies. The eligibility rules, the local allocations, and application timelines for most of those programs are still evolving. For the general funds, COVID-related expenses, the most likely source of funding will come from 2 primary sources. First is the Coronavirus Relief Fund, and I'll go into that in more detail on the next slide. And the second is the FEMA Disaster Relief Fund. FEMA has received about $45.4 billion in supplemental funding related to this event. However, they have given us guidance that all other funding sources need to be exhausted before FEMA will pay out. Next slide, please. So the coronavirus relief fund became available through the CARES Act, and it's designed to provide payments to states, tribes, and local governments that exceed 500,000 in population for a total of $150 billion. The state of Idaho's total allocation will be $1.25 billion. Because we have no local government units greater than 500,000 in the state of Idaho, no local governments will be eligible to receive direct funding from Treasury. However, the state has indicated that they will provide a portion of their funding to local governments. A financial advisory committee was established by Governor Little to determine disbursements. It's a 15-member committee. Alex Adams, the administrator of the Division of Finance and Management, is the chair. Local government representatives include Garden City Mayor John Evans, as well as Seth Grigg, the executive director of the Idaho Association of Counties.
Madam Mayor? Madam
Sorry,
Mayor?
I'm muted. Go ahead.
Yes.
Thank you, Linda. So I have a question about whether or not tribes are going to be included in that. Is that going to be something that's going to be up to the state to decide whether or not they provide money to the tribes?
No, actually, the tribal funding is separate funding that has been set aside by the Treasury Department that is distinct from what will go to states and local governments. About, I think, 139 billion is available to states and local governments, and the remainder is set aside specifically for tribes.
Thank you.
You're welcome. The Financial Advisory Committee has met 2 times already, and the process is moving very quickly. They expect to start making disbursements on April 24th and have the program operational before that. The city has submitted an estimate of our expenses on April 10th that may be eligible. We expect detailed guidance on which expenses will be eligible for reimbursement from the U.S. Treasury any day now. So far, the high-level guidance that we've gotten from the state indicate that they do plan to provide funding to local governments, that the funding will cover unbudgeted COVID-19 related expenses incurred from March 1st to December 30th. However, revenue losses are not eligible with this round of funding. With that, I will stand for any questions.
Madam Mayor?
Council President.
Thank you. So Linda, this may be a question for Madam Mayor, but I guess knowing that the 4th round of funding is being discussed right now, and one of the issues in it is whether or not to provide direct funding to local governments, that, as I understand it, would include funding that could cover revenue losses. Are we, would it behoove us to, are you contacting our congressional delegation, and would it behoove us to have another letter from the city council about that?
Sorry.
That's okay.
Yes, I mean, as you know, our representative in DC is tracking all of us as closely as she can, sending updates when possible. Anytime the council would be interested in communicating on these issues, especially as we're looking at the 4th stages and, you know, eventually probably the 5th and 6th stages, it's welcome.
Thank you. We'll work on that.
Okay, barring any other questions or comments, thanks, Linda. We will move on to the update from Cody regarding public hearings and that process. Cody, are you still on?
Yep. Can you hear me?
Yep.
Yep. Okay. Thanks, Madam Mayor, Council. It's nice to see all of you. I kind of miss our Tuesday evenings together. I've been preparing and presenting at these for a long time. It's been a big part of my life. I guess I was asked to provide a brief update on my team's efforts as it relates to public hearings, specifically planning and zoning, design review, and historic preservation commission. I guess, but first I'll abuse my privilege of getting to speak just by saying thanks for everything all of you are doing to keep us all safe. it's greatly appreciated. As far as our public hearings are concerned, on PDS, we actually have somewhere around, I think, 60 items that need action at a hearing right now. Again, that includes council, but also planning and zoning, historic preservation, and design review. Some of these have been in for quite a while. Some have come in recently. We actually continue to receive applications, both administrative and hearing level. The team's continuing to review and actually issue approvals administratively. But for hearing items, while we're doing everything we can short of the actual hearing. We're transmitting information to other agencies, neighborhood associations for comments, conducting as much of our own analysis as we can, and completing to the large extent our reports. There's a lot of good work being done, but without that hearing, we're really not benefiting the applicants, I guess. Recognizing that there's still a period of time before we return to a conventional hearing format, we've actually started testing the online platforms, specifically Zoom, like we're using tonight. In addition to PDS, we've actually participated in sessions with IT, city clerk, even your own Amanda Brown. We've practiced facilitating meetings, much like Amanda and IT do for you. We've actually also tested and practiced our ability to allow applicants and the public to testify in this format. Taking it a step further, this week we've started practicing with each of our boards using the software. Next week, we plan to engage in at least a couple of sessions with the neighborhood associations. They've expressed interest in that. And depending on how that goes, we'll probably conduct some follow-up sessions as needed. I don't think I can say that this would be ideal for larger items with a lot of interest. Those are probably just going to have to wait. But I think based on all this testing, we're confident that we can conduct some hearings on some very basic items. And in our mind, this accomplishes a couple things. It'll allow some applicants to proceed with their projects, and also helps us kind of avoid an almost insurmountable backlog of work when normal business does resume. I think I want to be clear, we're talking some of the very basic items we deal with that are often with very little, if any, public interest. Think small projects like maybe an addition to someone's single family home in a historic district, maybe a small office or commercial building, some of the basic waivers or variances we might see. Again, historically, things that don't have a lot of interest. More often than not, those are actually approved on consent agendas at these lower bodies. However, we are prepared and continue to test kind of our ability to accommodate that testimony if it arises. We've been working with community engagement to update our own notices, postings, and website, so we can clearly communicate how people can view a hearing, but also participate and provide comment. With your blessing, we'd really like to shoot for conducting some of these, again, very basic hearings the first couple of weeks in May. Again, if those go well, we'd schedule additional meetings. We believe we have enough kind of those basic items, probably for two meetings with the Planning and Zoning Commission, and perhaps just one with design review and historic preservation as we sit today. Obviously, things are changing every day, and we don't know, what things are going to look like later in May. If you support this approach, and it doesn't look like we can return to conventional hearings for a period of time, I might suggest that I report back after our first round of hearings, just see how things are going, answer any questions you might have, and see how we'd like to proceed from there. I want to be clear, there's definitely a benefit to a lot of people, I think, completing some of this work, but it's really important to us that we don't infringe on anyone's right to due process with all of this. If we run into trouble from a technical perspective, we do have the discretion ourselves to ask for reconsideration. And so that we kind of have that fallback. And again, I believe, in short, we believe we can conduct some very open, basic hearings without endangering, the safety of the public. That's my update. I'm looking for confirmation from all of you on whether or not we should proceed. With any hearing, I think it's important that we understand there's about a 2 to 3 week period leading up to that, to where we can properly notice things. So to handle some of this very basic stuff in May, we really need to get started with our noticing even this week. I guess just one last note. If we do proceed, I believe we'd need to have an amendment to the kind of the emergency declaration, perhaps at April 28th. We've spoken briefly with legal and they're aware of this need. And perhaps that could be combined with some other changes, but that makes it clear we can use this tool to proceed with these basic hearings. So with that, thanks again for your time today and happy to answer any questions you might have.
Madam Mayor.
Go ahead, Council President.
Thank you. Well, thank you, Cody. Thank you for being here. It's good to see your face as well. And it sounds to me like this is a plan that we certainly should try. I have two questions. One, do any of these require a neighborhood meeting? I know I viewed after the fact an online neighborhood meeting that seemed to go well, actually, and wondered if you could tell us a little bit about any more activity on that front.
Madam Mayor, Councilmember Clegg, the items we're considering first had the neighborhood meetings sort of, before things got really bad. You're right. A few applicants have tried using this Zoom platform for neighborhood meetings since then, and I've kind of been a silent observer to some of that and had that video sent out. And you're right. In my opinion, that I think those meetings actually went very well. There was a lot of back and forth, sharing drawings, sharing email addresses, and I don't know. In some ways, you might argue that those neighborhood meetings were more effective than a lot we've heard of. But I think if this goes on for a long time, that the online Zoom tool is going to be important for neighborhood meetings as well. We've been very clear with potential applicants that would be a good first step. And then if they have that neighborhood meeting and there's a ton of interest, opposition, that we do have the discretion to require a second meeting. And so that it's not the end all be all, I guess.
So follow up on that. As you work with the neighborhood associations next week on your testing, will you be asking them about the neighborhood meeting platform as well?
Madam Mayor, Councilmember Clegg, certainly. I mean, we want to, even if it's just a conversation with them, I think that would be beneficial at this point, just to see how they think things are going. But with each group so far, we've kind of practiced, just simple things, toggling how to share your screen, provide your own presentations, raise your hand in the virtual world, but certainly kind of getting their input on the neighborhood meetings would be important.
Great. And then my second question, the 60 items that you referenced, are all those public hearings or did those include subdivisions? And if not, how many subdivisions are there out there?
Madam Mayor, Councilmember Clegg, we did include kind of the preliminary plats in that you would typically have a hearing for. We do have a very few things for council, vacations of easements and things like that are basic as well. So if there's interest, and I think we have a meeting later this week on some of the potential items for council that are very much like what I just described for the lower bodies. On May 5th, I'm bringing the flood.
Madam Mayor, Councilmember, Council President Clegg, yes, we do have a meeting later this week between staff to just kind of walk through what would kind of resuming activities at the city council level be for the month of May and into June. So we'll get you some more information as far as which ones are public hearing and non-public hearing.
Okay. And then finally, Madam Mayor, this item is not listed as an action item. So I think we could, nod our heads and give direction to go forward with this. But if we need formal action, we'll have to add it to an agenda later for that.
Well, and the formal action will need to be that we amend
the order.
Like the action that needs to take place is that I submit an amended order.
Okay, thank you.
Yep.
Madam Mayor.
Madam Mayor.
Councilman Thompson, then Woodings.
I first of all, I want to thank you, Cody. Appreciate your hard work, your entire team's work, and the sensitivity that you're giving to the issue and the importance of ensuring we do it the right way to involve the public in whatever way we can. But I just wanted to throw my support 100% and 10% support behind getting moving forward, as you stated, in early May with some of these smaller items. I think it's an absolute must, and I appreciate your plan of action.
Thank you.
Madam Mayor.
Go ahead.
Thank you. Cody, and I guess Madam Mayor also, I just want to comment on Boise's approach to our public meetings and how that's differed from some of our neighboring jurisdictions. And I really think that we did the right thing by pulling back on all of them and then going about the work of figuring out how we could do some of these meetings without violating due process and while offering good processes for neighbors to provide input. And I just want to commend Cody and his team and legal on doing all of the work necessary to see that we can put a little bit of non-controversial business through so that our building trades are able to get some work done in housing our folks. So tremendous work all, and I am really looking forward to seeing how it works in the real world.
Thank you.
Good, thank you, Cody.
Yeah.
Thank you.
Madam Mayor, yeah,
Oh, Councilman Halliburton.
yeah, thank you. I'll second everything that everybody else said. There's a couple of things that I did want to bring up. One is that I'm wondering, and maybe Cody, you talked about this a little bit already, but if it sounds like you've already identified, less controversial things that are going to take less input. I'm wondering if there is any plan for any extra outreach for folks where you could answer any questions before the meeting even had to take place, so people may not even have to call in or come in, and if that's part of the plan.
Madam Mayor, Councilmember Halliburton, certainly to the we'll be modifying our noticing templates to kind of provide some clear contact information and things like that. The hope is that people will reach out to us. We'll encourage, if at all possible, comments in written format. If we see, for the items we're talking about that have already had neighborhood meetings, that's a pretty good indication that there's not a lot of interest in it already. But certainly anybody that contacts us, we'll do our best to sort of coach them up in preparing for the hearing. And certainly I suppose if it's one of those odd, rare items that out of the blue people get interested in really late, we could always back off and ask our board to just defer that. Again, it's really important. We really want to move some of this forward, but we certainly don't want to infringe on anyone's rights to participate, whether it be by phone, writing in, or presenting like this.
Madam Mayor, Cody, I really appreciate that, and that extra emphasis on trying not to infringe on anybody's rights. The other part about this that I think is also sort of exciting is I do think that it starts to open up an opportunity for somebody who had no other ability to get down to a meeting potentially in the future, because of different accessibility issues, and using this as kind of an opportunity to maybe open doors in the future. And so I really appreciate your work going into this. And I'm not saying that I want council meetings to go even later on in the evening, but just the aspect that there may be people who haven't been able to make it down to a meeting before in the past for a variety of different reasons, and this sort of exploration, opening up our council meetings to be even more accessible to our community. So thank you, Cody. I really appreciate it.
Thank you, Madam Mayor. If I could just briefly before we're going, there are a lot of very, very smart people in IT, my own team, community engagement that have. I sort of fell off most of the tech wagon, I don't know, a handful of years ago, but there are a lot of smart people in those groups that are making tonight's hearing and all of that possible. So they deserve a ton of credit.
Great, thank you. Mallory, did you have additional slides, or was that it?
Madam Mayor, I think that was it. The only other tickler we had was to chat about potential future orders, but I think you kind of covered that early on in your opening comments. So aside from that, that was all that we had. And I have a couple of action items to follow up on for you guys. So we'll be following up on those.
Great. Thank you very much. Appreciate it. All right. Now I've got to find my agenda again. I think it's the consent agenda is next. Council President, you're muted.
I've been trying to mute so that there's a saw running in my neighborhood, and I didn't want everyone to hear it. So thank you. Before I make a motion, I guess I'd like to just note a couple of things. One, the internal audit report is on the consent agenda. Council members haven't indicated any questions about it, but certainly this would be the time to ask if anyone did have one. We also have 2 resolutions on the consent agenda concerning orders that you reissued order for the closing of public meetings and some clarification on the governor's order. And I just wanted to note that those were on the agenda. And with that, I would move approval of the consent agenda as presented.
Second.
We have a motion and a second. Clerk, will you please? Oh, before that, I'll just say Steve Wren has been on here as an attendee and our independent auditor. So thanks, Steve, for sticking it out and for the reports. With that, Clerk, would you please call the roll?
Sanchez,
Yes.
Thompson,
Yes.
Woodings,
Yes.
Bajent,
Yes.
Clegg,
Yes.
Halliburton.
Yes.
All in favor, motion carries.
Thank you, Char.
You're
Let's
welcome.
see. Next up, ordinances on the second reading.
Madam Mayor.
Yes,
Go
is that
ahead.
the one that, did I miss?
Madam Mayor, before we start, and I probably should have done this at the beginning of today's meeting, but I did not have the ordinance number in front of me, and I apologize for being unprepared. However, I would like to move that we defer ORD 14-20 to a date certain of June 23rd, 2020. And I'll provide reasoning if I get a second.
Second.
All right, go ahead, Council President Pro Tem.
Thank you, Madam Mayor. ORD 14-20 deals with our hands-free ordinance that we recently passed as a council. And recently in the state legislature, they also passed a hands-free ordinance that is extremely similar to this one. That one takes effect not until July 1st. And so under the guidance of our of our legal department, we are repealing our ordinance, but I thought that it would be more prudent to wait until the state's statute takes effect July 1 before we repeal ours. And I think that that provides some continuity for our citizens on what it means to drive in hands-free mode with your mobile device. And I think it continues to protect the safety of our residents before that state statute takes effect. And so the intention is to work with our police department and make sure that we're on the same page as far as what the state statute requires and how that might be different than what our city ordinance required, and make sure that we're educating drivers on what that will look like when it is enforced, not writing people tickets in the interim, but just making sure that we're educating drivers and that everyone's even more prepared when the state statute takes effect on July 1.
Thanks. Thank you. Clerk, will you please call the roll?
Sanchez,
We got a yes.
Thompson,
Yes.
Woodings,
Yes.
Bajent,
Yes.
Clegg,
Yes.
Halliburton.
Yes.
All in favor, motion carries.
Thank you. And now we do have one ordinance on second reading.
Thank you, Madam Mayor.
Go ahead.
I ask unanimous consent that all ordinances on the second reading calendar be read by number and title only and filed for the third reading calendar.
Second.
A motion and a second. Clerk, will you please call the roll?
Would you like me to read it?
Oh, sorry. Yeah.
That's okay.
Oh, because you did unanimous consent.
Unanimous, so without objection, yeah.
ORD-13-20, an ordinance CAR 15-00029, Corey Barton Homes Incorporated, enacting Title 11, Chapter 13, Section 3 of the Boise City Code to codify the Syringa Valley Specific Plan District SP-03 provisions previously approved by Boise City Council, adopting the Syringa Valley Specific Plan approved as part of CAR 15-00029, amending Title 11, Chapter 5, Table 11-05.1 to add reference to Syringa Valley Specific Plan District, approving an ordinance summary and establishing an effective date.
Okay, thank you. All right. That looks like there's nothing else to come before the council.
Madam Mayor, I move we adjourn.
Second.
We have a motion and a second. All in favor?
Aye.
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 Opposed? All righty, we are adjourned.
Thank
Take
you,
care,
everyone.
I'll miss you guys until next week.
Yeah.
Bye.
Feel safe.
Bye.